Healthcare systems were defined to tackle challenges that societies were facing in the mid-20th century, basically to manage acute episodes. But today, the rise of life expectancy, combined with the increased adoption of a Western lifestyle, is dramatically increasing the prevalence of chronic diseases worldwide. Diabetes, cardiovascular diseases, and cancer are rated as first causes of death and treatment of patients that suffer from chronic conditions and cost around 70% of the overall budget of the healthcare system in the developed world. Needs, challenges, and priorities have changed the healthcare systems and are at a crossroads and calling for deep transformation from a reactive to proactive and predictive model where caregivers, authorities, and payers promote a healthy lifestyle and screenings according to inherited or adopted risks of developing chronic disease. Today's patients are much more empowered about their health conditions and demand better quality of care and better access, regardless of where they are, so that healthcare systems are moving from an institution-centered model where patients need to go to hospitals and health centers to a decentralized model where they can have access to caregivers from home, work, or while they're on vacations. We in Etisalat believe that digital technology plays a core role to enable this transformation. We put the patient at the center of the healthcare system, and all our solutions are defined to create more efficient processes to build a more precise, proactive, connected, and sustainable model. Our proposition is based in 3 axes. Smart Hospital. We aim to be the strategic digital partner of main healthcare providers by providing solutions that will enhance patient experience and satisfaction, solutions that maximize the performance of caregivers, and reduction of medical errors. Etisalat is ready to manage the end-to-end digital and technological needs of hospitals, allowing a reduction of operational resources needs. Health providers should focus on their core business, which is patient treatment, and should invest in healthcare delivery and rely on a strong partner to look after technology-related matters. Health Information Framework. Leveraging on the strength of our network, cloud, and combined with our health information bus, Etisalat is aimed at providing solutions to guarantee that every stakeholder involved in a care process can universally access to the right information when is needed and optimize the ICT expenditure, unified medical records, e-prescriptions, e-claims. Population Health Management. Etisalat remote patient monitoring services that enable patients to have access to caregivers from home or work and chronic patients to be monitored by their doctor 24/7. Welcome to the Intelligent Healthcare and Innovation Center. Our health and well-being are the most important elements for longevity. No one plans to get hurt or sick, but most people need medical care at some point. Healthcare does not rely on the traditional bricks and mortar model of a patient coming to a hospital in a reactive situation to get medical assistance. With Etisalat Digital, we can proactively go to our patients, delivering better healthcare today. So first, let us set the scene for you. For our case study today, we have received a request from our patient, Mr. Abdullah Hakim, to get a clearance to travel for a month. He has several diagnoses that we will go through to analyze how safe it is for Mr. Hakim to travel. But before we dial him, let's have a look into his file. All right, doctor, would you like to open the patient's file? All right, doctor, where would you like to start? Mr. Hakim has a complicated history and has been diagnosed for type 2 diabetes. The diagnosis of T2DM was made in 1994 when he was admitted to Rashid Hospital with palpitation. He was initially managed with oral antihyperglycemic agents for many years, but then changed to insulin. He is now on 3 types of insulin. As you can see, his diabetes is currently managed by Dr. Samira at the Diabetic Clinic in Dubai, and he has his next checkup on Thursday the 13th of October. The patient had his last HbA1c check here 3 months ago, but the result is unknown. He is due to have his next HbA1c check in 2 months this year, but is keen to have us check it now as he wishes to travel for a month. We can also see the past random/pre-meal blood glucose BG readings, and his diabetes doesn't appear to be well controlled. You can now click on any of the points to read more into the current medical diagnosis of Mr. Hakim. All right, doctor, where would you like to start? What else would you like to see, doctor? Identifying the gene's underlying susceptibility to human disease represents a major breakthrough in biomedical research. DNA profiling is laying the groundwork for the era of personalized health management, in which the current one-size-fits-all approach to healthcare will give way to more customized strategies. The test information will enable healthcare professionals to tailor prevention programs to individuals based on their unique genetic makeup. All right, doctor, where would you like to start? All right, doctor, we are going to dial in the patient. I am going to assist you with the preliminary vitals checks so that you can prescribe a diagnosis. Good evening, Mr. Hakim. How are you today?
Good evening, doctor. I'm doing well. As you know, I plan on traveling for a month next week, but wanted to get an all clear from you, as well as get an update on how I am doing. I have diabetic checkup next Thursday at Cleveland, but wanted to check my HbA1c today.
No problem, Mr. Hakim. Can I please request you to connect your blood pressure wearables so we can check your BP? Thank you, Mr. Hakim. Can we also check your weight? Are you stabling at 88 kilograms as per our last check?
Yes, I am at 88 still.
All right, Mr. Hakim, that's a little higher than what it should be, so we will look into that as well. Let's check your blood sugar again. We picked up your random sugar levels at 265 today. Let's try that again. Healthcare today has the most important prerequisites, the right doctors, already in place. What we are showing you today is the ability to equip them with everything they need, all the right information about their patients, all in one place, to do what they do best, provide the right healthcare to everyone. Thank you, Doctor and Mr. Hakim. Here is what we are going to do for your treatment. We are sending a request to the lab for the following tests: HbA1c, CBC, lipid profile, renal function, and ferritin. Give us one moment whilst we locate the right lab for you. First, let us look at labs that are closest to you. Let us also cross-check that with the next available appointment for you. Well, Mr. Hakim, it looks like we have a 2 p.m. appointment available for you at Hilal Labs in Sakiem. We can also have a car parking space reserved for you at the time of your appointment. We are also going to request the wellness program team to review and advise you about your diet so we can assist you with losing some weight. The team will also help you understand your conditions in more details and will assist you with information about your meal plans and what you can do while you are away to manage your condition. Can we also request you to test your vitals, your BP, temperature, HR, and O2 stats twice daily, and blood sugar, initially QDS, for the first week? We will monitor this remotely to keep track. We would also like to do 2 home videos this week and 1 more before you travel next week. after which we will connect with you on conference calls so that we can constantly monitor you while you are away. So please, use your BPAP machine regularly. We recommend you start taking your pantoprazole as well. We are sending this to the pharmacist to get this delivered to you. Let us check who has stock of your medication close to you. We have placed the order for your medication, Mr. Hakim, and they will be dispatching this to you in the next 24 hours. We are also sending our diagnosis to your insurance to get the approvals of your lab tests and medication. Thank you, Mr. Hakim, and we wish you a wonderful day and the best of health. From the analysis, a clinical KPI has been set for your doctor and added to Mr. Hakim's file. So as you can see, from patient care in a hospital to patient care at home, from paperwork and files sitting in multiple departments and multiple hospitals, to getting all relevant data on your screen at your fingertips. From reactive to preventative healthcare, we are not selling you the future. We are demonstrating healthcare today.